Diabetes is a chronic disease caused by blood sugar control problems. But its effects are not limited to blood sugar. In particular, its effects on heart health are very significant. Did you know that cardiovascular disease is the leading cause of death for diabetic patients? Today, we will learn in detail about the 5 key rules for maintaining heart health that diabetic patients must know. 1. Blood sugar control is the basic of the basics. For diabetic patients, blood sugar control is the basic of all health management. High blood sugar damages the inner walls of blood vessels and promotes cholesterol accumulation, causing arteriosclerosis. This directly increases the risk of heart disease. It is important to consult a doctor to set a target blood sugar level that is right for you and manage it consistently. Generally, the target is fasting blood sugar of 70 to 130 mg/dl, blood sugar 2 hours after a meal of less than 180 mg/dl, and glycated hemoglobin of less than 7. However, it is necessary to observe your lifestyle and symptoms well and manage them individually. It is important to check your blood sugar regularly, eat, exercise, and take medication consistently. 2. Maintaining blood vessel health by managing cholesterol. Diabetic patients are more likely to have a higher blood sugar level than the general public. You should pay more attention to cholesterol management. This is because high blood sugar tends to increase the level of bad cholesterol, LDL cholesterol, and decrease the level of good cholesterol, HDL cholesterol. LDL cholesterol should be managed to less than 100 mg/dl and HDL cholesterol should be managed to more than 40 mg/dl. To do this, improving eating habits is essential. It is helpful to reduce the intake of saturated fat and trans fat, and consume blue fish, olive oil, nuts, etc. Rich in omega-3. Regular exercise is also very effective in increasing HDL cholesterol. It is recommended to practice moderate intensity aerobic exercise for more than 30 minutes a day for more than 5 days a week. If necessary, you can also consider taking cholesterol control medication by consulting a doctor. 3. Blood pressure management is the key to protecting the heart. It is known that about 60% of diabetic patients have high blood pressure. High blood sugar stiffens blood vessels and affects kidney function, causing blood pressure to rise. On the other hand, high blood pressure increases insulin resistance, making blood sugar control more difficult. The target blood pressure for diabetic patients is less than 130/80 mm of mercury. To this end, a low-salt diet and regular exercise are recommended. It is essential to limit daily salt intake to less than 6 grams and consume plenty of fruits and vegetables rich in potassium. Stress management is also important. Chronic stress increases blood pressure and interferes with blood sugar control. It is helpful to find and practice stress relief methods that suit you, such as meditation, yoga, and deep breathing. 4. Strengthen the heart muscle with regular exercise. Exercise is an important treatment method for diabetes management, just as important as medication. It has a particularly large effect on heart health. Regular exercise lowers blood sugar, increases insulin sensitivity, and helps with weight loss. It also strengthens the heart muscle and improves blood circulation, significantly reducing the risk of cardiovascular disease. One thing to note is that suddenly starting high-intensity exercise can be dangerous. It is recommended to start with a light walk and gradually increase the intensity and time of exercise. Do aerobic exercise and strength training in parallel, but adjust them according to your physical strength and health. Be sure to check your blood sugar before and after exercise, and prepare snacks to prepare for hypoglycemia. Also, if you have diabetic retinopathy or neuropathy, it is important to consult a doctor to find an appropriate exercise method. 5. Early detection and early response through regular heart checkups. For diabetics, even if you have no symptoms, you should get regular heart checkups. This is because cardiovascular disease can progress without clear symptoms in the early stages and suddenly develop into a serious condition. It is recommended to get an electrocardiogram test at least once a year and, if necessary, get an exercise stress test, cardiac ultrasound, etc. In addition, if symptoms such as chest pain, shortness of breath, and palpitations appear, you should visit a hospital immediately. In particular, if you are over 50 years old or have had diabetes for more than 10 years. The risk of cardiovascular disease is even higher, so more careful management and regular checkups are necessary. You can also consider checking the condition of your cardiovascular system precisely through a coronary artery calcium score test or coronary artery CT. Consistent management is the key to protecting your heart. For diabetic patients, heart health management is not an option but a must. Regular exercise, regular checkups, along with blood sugar, cholesterol, and blood pressure management can significantly reduce the risk of cardiovascular disease. This is not something that can be achieved in a short period of time, but a task that must be practiced consistently throughout one's life. The important thing is to accurately understand your health status and work closely with medical staff to establish and implement a management plan that is tailored to you. Having diabetes does not necessarily lead to heart disease. Rather, this will help you develop healthier lifestyle habits and take proactive health management to protect your heart health and improve your overall quality of life. Finally, if you found this information helpful, please subscribe to our channel and like and set notifications. We support your healthy life.